If you've heard the name Seroquel, you've probably heard the same questions too. Why does it make some people so sleepy? What are the big warnings? And what should never be mixed with it without double checking first? This video is educational only and is meant to translate the medication label into plain English. I'm not a doctor, and this is not medical advice. For personal questions about your medication, side effects, or interactions, talk with your doctor, pharmacist, or another licensed clinician. Seroquel is the brand name for Quetiapine. It was developed by scientists at AstraZeneca in the Zeneca lineage in the mid-1980s, and it received its first US FDA approval in 1997. The original brand was Seroquel, and an extended release version later came out as Seroquel XR. Seroquel is an atypical antipsychotic, which is also called a second-generation antipsychotic. That name can sound intense, so here's the plain English version. This medication changes how certain brain signaling systems behave, especially systems involving dopamine and serotonin. Those chemicals help regulate mood, thinking, perception, and emotional intensity. When those signals are out of balance, some people can experience severe mood swings, depression and bipolar disorder, mania, agitation, or psychosis. Quetiapine also affects other receptors in the body, including ones linked to histamine and blood pressure control, and that helps explain why people often talk about feeling very sleepy, lightheaded, or kind of slowed down on it, especially when treatment is first started or changed. One thing that gets lost online is that the exact full mechanism is not completely understood. In other words, medicine has a strong understanding of how it acts, but not every detail is fully mapped. For the immediate release form, Seroquel is commonly approved for schizophrenia, bipolar I disorder manic episodes, and bipolar depressive episodes. There are also pediatric approvals for some uses in certain age ranges, but the exact details depend on the condition and formulation, and that is something families should confirm directly with the prescribing clinician or pharmacist. For Seroquel XR, the extended release form, approved uses include schizophrenia and bipolar-related conditions. And in adults, it is also approved as an add-on treatment to antidepressants for major depressive disorder. That means it may be prescribed along with an antidepressant in some cases. You may also hear people talk about Quetiapine being used for sleep or anxiety. It is sometimes prescribed off-label for those reasons. That means a clinician may prescribe it for a use that is not one of the official FDA-approved indications on the label. That does happen in real life, but it is not the same thing as broad FDA approval for that use. A lot of people describe the common side effects in very practical terms. They'll say they feel really sleepy, or their mouth feels dry all the time, or they get dizzy when they stand up. Some people feel slowed down. Some notice constipation. Some notice increased appetite or weight gain. That heavy, sleepy feeling is one of the most common things people notice early. For some people, that sedation feels like a fog. For others, it feels more like a calming effect without the same level of heaviness. It can vary a lot from person to person. There are also side effects that may be less common than simple drowsiness, but are still important to know about. These can include low blood pressure when standing up, feeling faint or wobbly, increased cholesterol or triglycerides, higher blood sugar, movement symptoms like restlessness or stiffness, and slowed thinking or slower reaction time, especially when Quetiapine is mixed with other sedating substances. A big real-world issue is that side effects can stack. Someone who is already tired then adds alcohol, then takes an over-the-counter nighttime cold medicine, may suddenly feel much more impaired than expected. Seroquel also has some important warnings that people should not ignore. One major boxed warning is that elderly patients with dementia-related psychosis treated with antipsychotic drugs have an increased risk of death, and Seroquel is not approved for that use. There is also a boxed warning related to suicidal thoughts and behaviors in children, adolescents, and young adults in the context of antidepressant-related treatment. That does not mean it happens to everyone, but it is something clinicians monitor closely, especially when treatment is started or changed. Other serious problems that can happen include severe sleepiness or confusion, fainting, a very fast heartbeat, high fever with severe muscle stiffness and confusion, new or worsening unusual movements of the face, tongue, or body, symptoms of very high blood sugar such as unusual thirst or frequent urination with weakness, and severe allergic reaction symptoms like swelling or trouble breathing. If symptoms like these show up, contact a clinician urgently, and if symptoms are severe or escalating, seek urgent medical care. A lot of interaction problems happen because people assume a prescribed medication is automatically fine with everything else. That is not how it works, and Quetiapine has some important interaction categories to double check. Alcohol is a big one because it can add to sleepiness, dizziness, and slowed thinking. Even if someone has tolerated alcohol and quetiapine separately at different times, the combination can hit harder than expected. Anything else that causes sedation, slows reaction time, or increases dizziness can stack with quetiapine. That includes sleep medicines, benzodiazepines such as alprazolam, clonazepam, or lorazepam, opioid pain medicines, and other antipsychotics. Some medicines that affect heart rhythm can also matter, and some medicines that lower blood pressure can increase lightheadedness or fainting risk. Quetiapine can also interact with drugs that affect dopamine signaling, so medications used for Parkinson's disease, like levodopa, are worth a pharmacist review. It can also be affected by medications that change liver enzyme activity, which is one reason medication list reviews matter so much. Over-the-counter products are a very common place where people get surprised. A lot of people do not realize that routine OTC products can add sedation or anticholinergic effects. Examples include diphenhydramine, which is in Benadryl and many PM products, doxylamine in some sleep aids, some nighttime cold and flu products, and some motion sickness medicines. These can make drowsiness, confusion, constipation, dry mouth, and dizziness worse in some people. Supplements and other substances are worth checking too. Cannabis can add to sleepiness and lightheadedness in some people. CBD products can matter depending on the product and what else is in it. Melatonin, valerian, and other sleep-focused supplements may worsen sedation if that is already a problem. St. John's wort is another one to double check because quetiapine is processed through liver enzyme pathways, and some supplements can affect how medications are broken down. That does not mean every supplement is automatically dangerous. It means it is smart to run your full list by a pharmacist, especially if the supplement is for sleep, mood, or anxiety. If someone is having surgery, a procedure, or anything involving sedation or anesthesia, the medical team should know they take quetiapine. The reason is simple. Sedation, blood pressure effects, and heart rhythm considerations can matter during procedures. Seroquel, also called quetiapine, is an atypical antipsychotic used for conditions like schizophrenia and bipolar disorder, and the XR version is also used in some adults as an add-on for major depressive disorder. In plain English, it helps calm and rebalance brain signaling involved in mood, thinking, and perception. The most talked about side effects are usually sleepiness, dizziness, dry mouth, constipation, and weight gain, with some people also having blood sugar, cholesterol, or movement-related concerns that need monitoring. The biggest interaction themes are alcohol, other sedating medicines, certain OTC sleep and cold products, and drugs or supplements that affect liver metabolism. Seroquel also carries important boxed warnings, so it is one of those medications where regular check-ins and medication reviews really matter. What side effects should I watch for first with quetiapine, and which ones are common versus urgent? Are any of my other prescriptions, over-the-counter meds, or supplements likely to increase sedation, dizziness, or interaction risk with quetiapine? Do I have any personal risk factors that make blood sugar, cholesterol, movement symptoms, or heart rhythm issues more important to monitor? That's MedLabel Translator. No hype, no panic, just the label translated into normal language.